Hi, this is Dr. David Tenner here at the Goldberg Clinic for Chronic Disease Reversal, and today I'll be presenting a case from our clinic, a patient who came to see us with a diagnosis of psoriatic arthritis. Psoriatic arthritis is a chronic autoimmune condition characterized by red, ulcerated, scaly, flaky skin lesions, along with an associated arthritic condition that causes the patient to have significant discomfort, pain, and swelling in a variety of joints in the body. Having suffered with psoriasis myself, having been a former psoriasis sufferer in my childhood, teenage, and early college years, I know all too well how frustrating it can be to try to find lasting solutions for these kinds of health issues. Like many patients with psoriasis and other autoimmune conditions, I tried just about every treatment, supplement, diet I could find, all the while watching my overall health continue on a downward slope. It wasn't until I began to address the underlying causes of my health issues, rather than treat my symptoms, that I began to see lasting significant improvements in my health and eventually complete reversal of my condition altogether. And such is the case with the patient joining us in today's interview. After just 2 weeks on a program with us, one designed not to treat the symptoms of his condition, but rather to address the underlying causes, that we've already begun to see significant improvements in his health, in his symptoms, and his condition altogether. Hi, this is Dr. David Tenner, and we're here at the Goldberg Clinic for Chronic Disease Reversal in Atlanta, Georgia. And today we have with us Mr. Joe McCamey. And Joe came to see us from Peachtree City, Georgia. And Joe, why don't you tell our audience a little bit about what brought you in to see us?
Well, I've had psoriasis for 14 years, psoriatic arthritis for about 10, and just over the course of all those years, I've been trying to find something that would, something natural that would help me get rid of this. And been to a chiropractor, been through the supplement aisles, been to naturopaths, and everything just seemed to keep escalating in costs. And acupuncture, I've been to acupuncture, and nothing ever really did anything for me. It just cost a lot of money, but I knew that I didn't really ever want to go the route of Enbrel or Humira or the drugs. And
All right, so Joe, tell us a little bit about the symptoms that you were experiencing and the kind of vision you had for the rest of your life as far as where it was going with the kind of condition that you have.
Sure, I've got just spots of psoriasis kind of all over my body, not half covered, but I don't know, what would you say, 20%, 10 or 20% covered, something like that. But the arthritis was mostly what was affecting me. It would move around different joints 3 or 4 at a time, and quite debilitating for the most part. I mean, there was times where I couldn't walk up and down stairs. I'm an airline pilot, and getting off the airplane a lot, walking to the front of the terminal, I'd be limping, and people would be looking at me like, what the heck's going on? I'm like, oh, I just twisted my ankle playing tennis today or something like that, And so it was mostly the arthritis that was affecting me. And what was the next part of the question?
What kind of outlook did you have for the rest of your life dealing with this?
Yeah, it kind of was, I've got 2 kids and a wife, and I'm the breadwinner in the home, and it was constantly kind of stressed, just envisioning a path of my life, just envisioning myself in a wheelchair someday, and not having enough disability insurance or whatnot to provide for my family. And just like I was telling you here a little bit ago, I'm just now starting to see and believe that I have a bright future, that I can, run again and play tennis and roll around on the floor with my boys and whatever. So
Joe came in to see us at the clinic, and as with all of our patients, we did a comprehensive case history, physical exam. I spent a good long time with Joe so that we could uncover the root underlying etiological causal factors involved in the manifestation of his symptoms. That's one of the mistakes that most clinics make, is rather than focus on the causes of the problems, they rather instead treat the symptoms with herbal remedies, supplements, and all kinds of other things that don't really get at the root cause of the problem. So we had Joe in, we did a comprehensive case history, physical exam, did some lab work so we could better understand what was going on, what was causing his problems, and then we set him off on a path of action specific to his needs. And so it's been only 2 weeks now with Joe.
Mm-hmm.
Joe, tell us what has changed thus far.
Well, all my psoriasis lesions are flattened now. You know, they'll still scale a little bit, but you know, mine would raise up off the skin bed maybe 1 millimeter or so, and now those are flat. My forehead, when I first came in here, was beet red with, you know, flakes all over it, and you can see now that it's, I'd say it's 80% better than what it was 2 weeks ago. There's a spot on my leg that's gone, and my arthritis, like I said, it moved around my body quite a bit over the years, but when I came in here, I had it in my knee, my 2 index finger knuckles, and my ankle's pretty bad. And there are times when I walk around that it's completely gone. And today, I'd say it's about 75% gone. I mean, I can walk, you know, up and down the grocery aisle with no problem, and I'd usually be limping. So.
Right. And are you taking any medications right now?
None at all. No. And I was taking, you know, 2 months ago, I was taking 1 to 2 Advil a day and a Celebrex just to make me feel like I'm feeling now. So I feel like I'm walking around on.
Look at that.
You know,
So
3 or
we're
4
off
Advil a
drugs.
day,
We have
so.
significant improvements in Joe's skin, significant improvements in his quality of life and his ability to move and in his joint pain. He can get back to being a father, get back to doing all the things he wants to do. And we're still early on here with Joe. We still have a lot of room to improve. But the fact that Joe has put in some hard work and improved this much in just a short amount of time is a great indication that he has a tremendous amount of potential to get even better. And so we look forward to continuing to build upon the improvements that Joe has made, as long as Joe's willing to work hard and be consistent now.
I'm excited.
Which is always the key for patient success. We look forward to help Joe reach his goals, be a good father, go back to work, and be able to accomplish all the things that he wants to in life, essentially get his life back. So Joe, we thank you for sharing your story with us, and we look forward to continuing the improvements we've made thus far.
Thanks.
Thank you.